My name is Michael O'Rourke. I've been in practice for 18 years. I've been with Illinois Bone and Joint for 14 years. My specialty is joint replacement of the hip and knee. I'm someone who enjoys getting to know new people and taking care of people. It's very rewarding. I've loved being a doctor and I love orthopedics. It's a great field because patients are appreciative that they have such a change in their function and quality of life in a relatively short period of time. It's a very tangible benefit to people. When I meet a patient, I do a thorough exam and try to understand what it is that is bothering them, how it affects their life, and what their goals are in terms of activities and what they want to achieve. The decision to do a joint replacement is usually something that's been evolving over a period of time, and many of the patients have had treatments to avoid surgical intervention if they can. We see them through that and help them with the decision to move forward with the joint replacement. Part of the success of joint replacement is having an appropriate timing of indication and making sure that the value of the procedures we provide have a large impact on their life. It's been great working for Illinois Bone and Joint to have the autonomy to be a physician in an environment where we can make decisions purely based on the care of our patients, not tied to any organization or healthcare administrator who may or may not see eye to eye with what's in the best interest of the patient.